Good evening, everyone. My name is Jasmine Stanley. I am a graduate student here at Grand Canyon University. Today, I will be completing my pharmacology video presentation, so I hope you enjoy it. Today's agenda, we will be discussing anxiety disorders, bipolar and mood disorder, personality disorders, schizophrenia spectrum disorders, trauma and adjustment disorders. Additionally, we will be talking about the NASW social worker ethical responsibility. We'll also discuss anxiety disorders again, but this time we'll talk about the medication limitations and alternative pharmacology treatments. And I have also included my reference page. Let's get started. So when we look at anxiety disorder, okay, and I think it's very important that we always discuss the definition. So anxiety disorders are a group of mental health conditions that cause fear, dread, and other symptoms that are out of proportion to the situation, right? So everything feels so big. A fear comes over the person, dread comes over the person, and other symptoms, sometimes hallucinations, sweaty, just fearful, right? So let's talk about some of the primary medications that assist in helping with anxiety disorders. And those are usually SSRIs and SRNIs. Okay, so Zoloft, also known as sertraline, and Lexapro, also known as citalopram, they are primary medications used for anxiety disorders. And these medications have strong evidence for effectiveness and a safer long term profile. Okay, additionally, secondary medications are used are buspirapine, also called Buspar, and hydroxyzine, also known as Atarax, okay? And this is used when the first line medications are not effective or they're not tolerated well. So some of these medications, as we know, with any medication, there can be side effects. So when the primary medication is not tolerated well within a person's body or with the person's makeup, these secondary medications are used. So next, we're going to talk about the third line medications. Okay, so when we look at that for anxiety disorders, we're looking at Ativan, which is also known as lorazepam, and Xanax, which is also known as alprazolam. These third line medications carry significant risk, though, and I thought that that was very important to include. Also, they could possibly include dependence and memory impairment, okay? And these are reserved for short term use or crisis use. So that's very important to note when we're looking at anxiety disorders. So when we look at anxiety disorders, I think it's also important for us to look at alternative interventions, right? So alternative interventions looks like cognitive behavioral therapy, and you'll hear that word a lot throughout this presentation simply because CBT is usually used for a lot of different mental health disorders, okay? So CBT helps clients identify anxiety driven thoughts. Remember, we talked about that fear, patterns, and replace them with more balanced and adaptive ways of thinking. Another alternative would be mindfulness practices. So that looks like deep breathing exercises or grounding strategies. Exercise. I love to exercise, but one of the things that I've learned is that it does help with fear, it helps with anxiety, and according to my studies, it reduces anxiety significantly. Additionally, support groups, so it promotes coping skills. So all of these things help with it helps combat, I should say, anxiety disorders. So now we're going to look at bipolar and mood disorders. So a bipolar and mood disorder is characterized by periods of depression and mania, hypomania. So what that looks like essentially is when a person has really high highs, right, and then really low lows. Okay, so that's mania and hypomania. Primary medications that help with this are mood stabilizers. So lithium and Depakote. Another name for Depakote is Divoproex. And I might have said that word wrong, but Divoproex, okay? And what that is, those are best practice medications. So the primary medications are usually best practice, okay? They show strong evidence for effectiveness. So I think that's important to note. Secondary medications looks like olanzapine, which is also known as Zyprexa, or carbamazepine, which is also known as Tegretol. And this is used when the primary medication is just simply not effective, or like I said before with the anxiety medications, when they're not tolerated well within a person's biological makeup. Third line medications looks like haloperidol, and I've heard that word a lot because I've worked in a lot of different mental health settings or a lot of different clinical settings. Okay, so haloperidol, the other word for that would be, or the brand name for that would be Haldol, um, and chlorprozamine, and another word for that one is Thorazine. So that what those medications do is it helps combat acute agitation and severe mania. Um, so alternative interventions, okay, so as we said before, CBT is always going to be an alternative intervention, but for bipolar and mood disorders, it helps clients to recognize those early signs of mood shifts and behave, and it also helps for them to learn behavioral strategies, right, to prevent escalation. So that is what CBT does. It wants to prevent escalation. Okay. Interpersonal therapy, which is called IPT, that targets relationship stressors. Believe it or not, this often contributes to depressive disorders. Okay, depressive issues, depressive stages, relationship stressors. So IPT is a really, really good alternative for bipolar and mood disorders. Now let's talk about personality disorders. And I thought it was very important to note that personality disorders are a group of 10 mental health conditions that involve long lasting disruptive patterns of thinking, behavior, mood, and relating to others. So, primary medications for personality disorders would be citalopram, which is also known as Lexapro, fluoxetine, which is also known as Prozac. Okay, and these are best practice medications, again, strong evidence for effectiveness. Secondary medications for personality disorders would be duloxetine, which is also known as Cymbalta, and venlafaxine, which is also known as Effexor. So I wanted to note this. These medications are used when the primary medication is simply ineffective. Okay? So third line medications for personality disorders would be lorazepam. That's also a very well-known drug, also branded as Ativan. Additionally, clonazepam. And I was very shocked to see clonazepam because I know this is sometimes a medication that the dentist would give you to calm you down. I'm scared of the dentist. But when you go to the dentist, they would give you this medication to calm you down. So that's also known as Clonopin, okay? Clonopin. So alternative interventions for personality disorders. I know that we always say CBT, but another one that I learned about was dialectical behavior therapy. That's where they teach you emotional regulation, distress tolerance, mindfulness techniques. So I thought that was very important to note. Now let's look at the schizophrenia spectrum, okay? So schizophrenia spectrum and other psychotic disorders is the category of mental health conditions in which psychosis is the primary symptom. So we know that there will probably be a lot of antipsychotics, right? When you think about this. So primary medications for schizophrenia spectrum looks like risperidone, which is also known as risperidone, and also olanzapine, which is also known as Zyprexa. So that's best practice. And they're also better tolerated for long term maintenance. When you look at secondary medications, you would look at medications like we talked about haloperidol, which is Haldol, and perfazine. These are still effective medications, and sometimes they're necessary in acute stabilization. Okay, so third line medication for schizophrenia spectrum would be clozapine, also called Clorazil, clor- Clozaril, Clozaril. We'll go with Clozaril. Okay, and please forgive me for messing up these names. Um, Alternative interventions would be cognitive behavioral therapy, as we've talked about, but also lifestyle changes, right? Exercising, adopting healthy eating habits, mindfulness, and relaxation techniques. This one was very, very personal for me. So when you look at trauma and adjustment disorders, um, so, an adjustment disorder is a strong reaction to stress or trauma. So, when we see people with diagnoses such as PTSD or just trauma, where they just kind of feel like everything has been happening to them and the reaction is not always good. So some primary medications for that would be SSRIs, as we've discussed before, which is sertraline, also known as Zoloft, and paroxetine, which is also known as Paxil. These are best practice. They're effective for reducing anxiety, intrusive thoughts, and depressive symptoms. One of the reasons why I made it, I thought it was very imperative and very important for me to put the definitions of each disorder is because some of them sound like the same ones and they can be misdiagnosed if you're not educated on what specifically the disorder is, what the DSM-5 criteria is. So I thought it was very important for me to note the definitions. So when we look at secondary medications for trauma and adjustment disorder, buspirone, buspirone. That's a secondary medication, also known as Buspar. Okay, hydroxyzine, also known as Vistaril. Third line medications would be lorazepam, which is Ativan, and Xanax, which is alprazolam. Alternative interventions will obviously be CBT, but I thought it was important for this one, for the trauma and adjustment disorder, to note that family therapy is very important, right? Family therapy helps families understand the trauma responses, and they also learn supportive techniques and communication strategies that help reduce conflict and promote healing. So we understand that while it is very important to expose and diagnose these mental health disorders, it is extremely important for us to learn strategy to help combat these things. And I think it's also very important to educate family because you have such a stigma around mental health disorders or trauma or how a person perceives what's happening to them as opposed to how another person perceives it. So I think it's very important to educate families, individuals, partners, spouses. It's very important to educate them just so they can know how to handle their loved one, right? So we're promoting healing. So let's look at the National Association of Social Workers. Ethical responsibility to the broader society. Okay. So what do we do as social workers? Number one, we are to promote social welfare. Social workers should promote the general welfare of society from the local to the global levels and the development of people. At the end of the day, we are called to advocate for those that are marginalized. We are called to advocate for those that without a voice. And when you look at individuals who have or have been diagnosed with mental health disorders, a lot of time the stigma around that, they don't feel comfortable going around people. They don't feel advocated for. They don't feel supported. So as social workers, it is our role to support them and to advocate for those without a voice. Public participation. Social workers should facilitate informed participation by the public in shaping social policies and institutions. If that means that we have to lobby against big pharma, right? If that means that we have to advocate against pill mills and we have to advocate for stricter regulations, then that is our role. Social and political actions. Social workers should take, I'm sorry, social workers should act to expand choices and opportunities for all people. So we don't get to choose what person we work with. Our role is to simply advocate, right? So I think it's important for us to educate families, as I spoke about before. I think it's also important to educate individuals on medications, right? The side effects of the medications. I named a lot of medications when we talked about the different diagnoses, but I think it's important to educate our clients. This is what you're taking. This is the side effect. This is how it can help you. This is the primary. This is the secondary. This is third in line. So I want you to know how important it is for you to know. I want you to be informed about your health, right? Again, advocating for me, advocating for holistic mental health treatments and educating the community. The community sometimes is not educated. So that is where a lot of the stigma comes from, where you think about how people discuss mental health or how it's broadcasted about on social media or other platforms. Sometimes it's so looked down on, where people who have these issues, they don't feel like they have the political backing to help them. So as social workers, it is our role to get in the faces of politicians, of government, to help fight against the stigmas surrounding mental health. So let's look at anxiety disorder, okay? So I want to look at anxiety disorder, and I specifically want to talk about medication limitations and alternative um, treatments, okay? So what are the medication limitations? Let's start there. Medications commonly used for anxiety disorders such as SSRIs and SNRIs and benzoidazepines can be effective, but each one has important limitations, right? SSRIs and SNRIs may take several weeks to really reach full effect. So you have a person that's in a active crisis, and it might take several weeks for it to reach and to really help them. Additionally, many may face temporary increase in anxiety. So while they're taking the medication, one of the limitations is the anxiety might go up. And often it causes side effects such as nausea, insomnia, and for some, sexual dysfunction. So I think it's important to educate clients when they're taking these medications. Buspirapone provides a chronic anxiety relief without sedation or addiction risk. So I think that that was good to know as an alternative treatment. Um, it can also offer short-term calming effects for acute distress. Okay, beta blockers as well. They can reduce physical symptoms and performance-related anxiety. So some people have anxiety just from performance, having to perform. I have also included my references. I really hope that you all enjoyed this presentation. It was very educating for me to look at the different primary medications, the secondary medications, the third line medications, and to also note that there are other alternatives. Yes, medication is it's very good. It could be very helpful for the individuals, but I also think that if we're including some of those alternative interventions, such as CBT or family therapy, I think that would be very, 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 very beneficial for our clients as well. So, again, I hope that you enjoyed um, this presentation. Again, I have included